Now I will begin the final assessment, which is the respiratory assessment. So first, I will be looking at the rib cage, again, making sure that they are expanding equally. I'll also be feeling for skin temperature, making sure I don't feel any mass or lesions anywhere. I will also be assessing for level of consciousness, make sure that the patient is responding. I will be looking at the person's facial expressions, see if they're in pain while they breathe. Um, I will also be looking at the patient's position to make sure that if they're in an abnormal position or if they're guarding, I can assess that as well. So now I'm going to begin with palpation. So again, this is just assessing skin temperature, making sure that they're not moist or sweating abnormally. I'm again confirming symmetric expansion, and then I'm also again detecting for any lumps, masses, or anything like that. So now for percussion, I will percuss for the lungs. And I would do the same on the posterior side as well. Okay, now I'm going to listen to their breath sounds. So while I do this, can I please have you take a deep breath every time I move the stethoscope? Okay, thank you. Begin. Good. During that, I was listening to see if I could hear any wheezing or absence of breathing during that. And again, I would also perform this bilaterally on the posterior aspect to assess from the back. And now that concludes the patient assessment.